Hey guys, this is like my third attempt trying to get this update for day 2 of my total disc replacement of my L4-L5 vertebrae or vertebral disc. So I had that surgery on the 7th, so I did an update of surgery day and then day 1 post-op, and this would be my day 2 post-op. I woke up from surgery with complete paralysis, and they believe it was related to the Exparel, which is it's the bupivacaine class of medication that they injected all throughout my abdomen because it's an abdominal approach surgery to get to the vertebrae because they have to remove that vertebral disc, and that is on your abdominal side of your spine versus a fusion where they fuse the back of your spine. So they have to go in intra-abdominally, and it's called an extraperitoneal. So what they do is go in and then they shift your peritoneal sac and your muscle all the way over to the right side of your abdomen, and then they're able to get direct access down to the disc, remove it, and mine was like almost non-existent and herniated, and so they were able to get that out. They use a thing called a distractor that opens up the space between your vertebrae so they can put in the first piece that's called the trial to get the right size disc that they're going to put in, and it's 2 titanium plates. It's called the Pro Disc, and then they cut grooves into the vertebrae above and below so it doesn't have slippage, and it's a porous surface that your bone grows into. So that's what's now inside of me, and all of my organs are kind of like shifting back into place now, but they use this medication called Exparel that numbs up your abdomen when they're all done with that to provide pain relief for the next up to like 72 hours, and they inject it around your back, around your spine as well. And from what they know, one of 2 cases now that has had the reaction of paralysis following that. So I woke up from surgery with complete paralysis from the waist down, of no sensation, no movement at all, and was terrified. One of my biggest fears was being paralyzed after surgery, and I woke up with that and was terrified. Hang on. The other thing that can cause something like that is when they do that distraction and pulling the vertebrae apart, they're like stretching on your nerves, on your nerve roots, and so their other concern was it from that, but because it was numbness and complete weakness, it seems more like it would be a medication related reaction, and I'm very slowly starting to get some movement and feeling back. So I was up yesterday with physical therapy. They were able to get me into a standing position and barely turned a little bit just to go to a commode, because it's one part after surgery, it's getting out that number 2, and then getting back into bed. I was able to sit in a chair for just a very short amount of time, but the pain was pretty bad. And then today we actually made it from my bed over there all the way over to this chair where I'm sitting next to the window, and we have some snow outside. Not the greatest view, but it's also snowy, and I have the sun kind of shade down, but it's nice to just move around. It's been nice to talk to people and use any sort of distraction techniques and use any non-pharmacological methods for pain management as much as possible. I'm still on oxygen. My breathing's been a little bit difficult just with the lack of movement, so using lovely things like my incentive spirometer to deep breathe. So that's for deep breathing exercises. Done some nebulizer treatments and stuff like that. So recovery has been rougher than expected, but for back pain, I also have a sacralized, I have what's called Bertolotti syndrome. So I have a transitional vertebrae that's sacralized, meaning attached to the pelvis on my right side. So that we knew could potentially cause a little bit of difficulty with recovery and extra pain. So like knowing that going in is helpful. So yeah, there's that. And then just doing like little self-care things can really boost your self-confidence and your esteem and just make you feel more normalized. So like one thing I did this morning, just like washing my face, brushing my teeth, like despite the pain I was in, putting on a teeny tiny bit of makeup, just a little bit of eye stuff filled in my eyebrows. I know it sounds stupid maybe to some people, but just kind of like normalizing your life a little bit with some of those things that you do on a normal basis can help just with getting through recovery and self-confidence and stuff. So that's something that I've been able to do today that I wasn't able to do yesterday, or obviously surgery day. So Thursday, so we've had Tuesday, Wednesday, and then today is Thursday. So they're expecting that I'll stay till at least Saturday, depending on just how things go. And I am trying to push myself, and I push myself too hard. So I be careful not to push myself too hard, because then it can set you back. So there's a fine balance for that. But I was supposed to go home like the day after surgery-ish, or the next day, and so it turns out that, I had an unexpected complication that is so incredibly rare that the doctors didn't even know like what it was and what was happening. So I wouldn't call that a concern of something that could happen to you. Anything can always happen with the surgery, but overall the care has been excellent. They've done everything to make sure that my pain is managed, that they're doing what they can to make sure they can fix what is going wrong, and right now time is the only thing, is waiting for that medication to wear off and regain sensation, and making sure I don't end up with blood clots from not being able to move much. So the little that I can move my legs I'm doing, and then we're doing DVT prophylaxis, so that's deep vein thrombosis. So we don't want one of those. We don't want a blood clot in the legs. So I'm on low Venox to prevent blood clots, and then have TED hose on, so the nice tight socks that help your blood return, and then SCDs as well. Those are the compression where they blow up with air and squeeze down. So I'm on those as well. So doing all of the right things, and just trying to keep a positive mental attitude with anything in healthcare. Definitely helps you in the recovery process. So I always encourage that. Encourage visitors if you can. If not, talking to friends and family on the phone. Yesterday I got to see my hubby and my little guy got to come up and visit for just a short bit. So that was nice to be able to see them. And we're working on position changes. Previously I was only able to lay on my back, and I can't get myself fully moved in bed, but we did like turning slightly and propping up, so that helped just getting some different movements, but it's also caused like some extra abdominal pain. So just trying to be really transparent with the experience of what a total disc replacement's like. Some people come out of it and are immediately in less pain than they were before. I would say that the pain that I'm experiencing right now is different from the pain I was having before overall. Some of it's overlapping and the same, some of it's different. Hopefully I'll start making these a little bit shorter and not all the way up to 10 minutes. But I'm just trying to like cover a lot of the information here in the beginning, and then from then on it'll probably just be more updates on how recovery is going. So the first 2 weeks is kind of the roughest, and then after that we're kind of on the uphill. And then I'm looking forward to getting back to my life and being able to do all the things that I was doing beforehand, because the bonus of a disc replacement is that you get to keep the mobility in your back versus a fusion where you lose it. And the disc replacement, the likelihood of further surgery down the road is really minimal, whereas fusions, you're likely to have more fusions because of all the strain you put on the vertebrae and the disc above and below where you have that fusion done. So I'm not having that issue. The new disc put in should maintain all that. So thank you guys. I hope you're enjoying this series. The other recording may pop up later if they approve my appeal. So thank you guys. Catch y'all later. If you have questions, drop them down in the comments.